Hi there, I'm Kate Walsh. I'm here today with Nancy Gayden, Senior Vice President and our Chief Nursing Officer. So Nancy, it's really a pleasure to take a moment to sit down with you. Most of our time we spend walking around the hospital together, and I want to say I've just been so impressed by the response of your team and just the great work that nursing is doing throughout the hospital. But I only see what I see. Tell me a little bit behind the scenes of how you've been preparing, how you've been planning, and how the staff are responding.
It's been a busy time and in a lot of ways really exciting. It is amazing how people step forward, how you see this other talents that they have to keep each other up, and also sort of the strategy that they can employ when you're trying to do things in a different way. One of the things that's kind of hit me is that it is a time that is very unusual because a lot of the employees, all kinds of employees, the nurses, are balancing a lot of stress in their home life. So they're worried about their elderly parents. They might have their children at home. They're worried about their own health with the stresses of being in an organization that is trying to really step up and surge to be able to care for more patients. So I think usually it ebbs and flows in a workspace. Some people are stressed and some people can support them. Right now it feels like everybody is balancing a lot, and but then you see these moments where people are able to lift each other up, and it's even more striking.
I know it really is. I had the opportunity to sit down with Beth Milichevsky on specifically that issue, that because of the nature of this disease and its prevalence in our society, it's very hard to find those spaces where you can renew yourself. So I would remind everybody to take a look at those videos so that you have the tools to cope with this, because we talk about surging, but based on your own planning, kind of where are we in this surge?
Well, we're really thinking of it in two themes. Critical care has its own need, and med-surg, beds are their own thing. So in the critical care space, the first things we've done is filled all of our regular ICU beds to full. Those have become pretty much all COVID patients and COVID rule-outs. And then we've been able to surge our non-COVID patients into the PACU space in Menino. So that's a very different place for us to work. And the next sort of chapter with that is we're going to be taking some of the rooms in the step-down area and creating them as ICU rooms. That's where I came from, and the nurses were down there planning. The ICU nurses had come downstairs to team up with the step-down nurses. On the med-surg side, it's been even sort of more unusual. Our first surge was into space that's always outpatient, so endoscopy and the PACU and pre-op area for the Moakley, which is our outpatient surgery center. So we're now using that for med-surg patients, surge with no E.
Right.
And our next space will be places that were before part of outpatient OB. So our antenatal testing area and our NST area, we're going to start to use those for med-surg bases. Then the other transition we made is we're caring for adults now in the pediatric space.
And so you and I had the opportunity to walk the new surge spaces over the weekend, and the thing that struck me was just how calm and organized they were. I mean, these were brand new spaces with all kinds of patients in them, and the team just it just felt like, we've got this.
Yeah, I feel the same way when I walk around. I'm amazed at how the nurses are very flexible for one thing, but also remember there's a lot of support teams that are really helping them. So those patients are getting food from the food services people, and they're getting supplies, and the phones work, and everybody else did their piece so that the nurses could focus on the patients. I'm grateful for that, but I agree with you. It's amazing how patient care just goes on.
It really is. Could you talk a little bit about how your team is working in different ways to support people through this pandemic?
Yeah, we've all seen the huge amount of disruption in all kinds of the sort of societal supports. And you started with a couple of examples, but I'll just start with a health plan. People need a lot of things at home, and some of the ways that they would usually get those are not working as they usually do. And so the nurses are very involved in care management activities, really making sure that people can stay on the path of getting the durable medical equipment they need, or their pharmaceutical support, or whatever it is. So I think, and nurses are very creative, and nurses are able to pull all sorts of things together. So I think maybe some of the work that they do to pull together supports is maybe the best example of nursing, really. We do have nurses now stationed in the lobbies doing temperature checks and evaluating visitors and patients who come in for ambulatory visits. That's an unusual role for a nurse. They do have
stopping people from getting care.
Getting. That's a great point. Right. Yes, exactly. Working with the security people to make sure that we're moving people in the right direction. We have nurses. I think in the emergency department, it's been a very different ED, right? So we don't have as many ambulatory people seeking low-level care. we have more people coming in by ambulance as a percentage, many more than usual. And we have patients who are sicker when they get to us, I would say. And so the emergency department is also sort of faced with needing protective equipment, not knowing what the patient needs when they come in, and having to prepare for the worst, sort of. So, kudos to the ED teams who are always ready for anything, but especially in this COVID-19 tragedy, have been doing things differently. They set up a tent. They've been able to move patients who have some respiratory symptoms out to the tent and test them there. So I think we have nurses in the testing centers for employees. We have a lot of nurses working in the employee area, answering questions by employees on different risk factors that the employee might have or their family member might have. And in the primary care offices, where you would think that because of the decline in visits, there is a huge decline in nursing work, that has not turned out to be the case. Yeah. Right, because the nurses do a lot of work on the phone, and families and patients have a lot of questions. And part of what the nurses are trying to do is keep the patient from having to come to the hospital. So sometimes that takes a lot of negotiation with the family and patient on the phone. So I would say this has been it's a great time for nursing, actually, I will say, because it shows all the different ways that that nurses can really contribute to people's health across the continuum.
Well, I want to thank you for creating an environment where nurses can really practice probably beyond the top of their license in ways that they hadn't even anticipated. And I want to thank you all for tuning in today.